In other stories, radiation oncologists at the Korle-Bu Teaching Hospital say they are being forced to place women living with cervical cancer on long waiting lists because there are only 2 radiotherapy machines serving the thousands of patients suffering from the terminal disease. Approximately 3,000 cases of cervical cancer are diagnosed annually in Ghana. Joy News' Adobe Asari was at a forum organized by Meg Sharp and Dome to promote education on a disease and reports it can take a cervical patient at least 3 months to be placed on a radiotherapy machine.
Cases of cervical cancer are diagnosed in Ghana each year, with 60% of affected patients dying from the disease. This high mortality rate is largely attributed to a lack of knowledge about the prevention, early detection, and insufficient human papillomavirus (HPV) vaccination coverage. Speaking at a dialogue organized by Meg Sharp and Dome MSD on cervical cancer awareness, specialist radiation oncologist at the Korle-Bu Teaching Hospital, Dr. Mary Ann Dadzi, lamented over the inadequate radiotherapy machines available at the facility. She said the situation is not only putting pressure on the existing machines, but is leading to the death of many women who are placed on long waiting time before they are treated.
So there are 2 government radiotherapy centers in the whole country, one in Kumasi, another in Accra. They were established in 2000 for 20 million people, and we are 34 million now. And there's still those 2 centers with 2 machines. It's terrible. Now, the waiting time to get onto the machine is about 3 months. Yes. That's a waiting time to get onto the machine. And the machine is breaking down every now and then. If you have money, you can go to the private center. But how many people can afford $3,000 or $4,000 for just the radiotherapy? So they wait, and sometimes when it's time for treatment, you call them, oh, the woman is dead. You call, is dead. We call them and they come in with metastasis all over. It's too late.
In Ghana, around 1,800 women die from cervical cancer each year. This high mortality rate is primarily due to the lack of vaccination, delayed detection, and insufficient awareness about the disease. Managing Director of MSD, Dr. Zweli Bashman, said, addressing these gaps is crucial to reducing the impact of cervical cancer on Ghanaian women.
I think it's important that as a healthcare fraternity, we focus on this. It is the #1 sort of cancer that, with the highest level of mortality on the continent. I can safely say that awareness levels are not where they need to be. And that's part of the work that we need to do. Ours is not just to work on the research, development, and manufacturing, but we need to create an ecosystem that is accepting of these healthcare interventions. So we spend a lot of our time and effort doing community social mobilization work, healthcare practitioner as well as healthcare consumer education. We work with religious bodies in terms of providing them with education. We work with, cultural leaders, providing them with education and information.
Addressing the issue of vaccination, Program Manager of the Extended Program on Immunization, Dr. Kobina Amponsa Achiano, noted that intervention is underway to start a HPV vaccination by October 2025.
Fortunately, the Minister commissioned the National Immunization Technical Advisory Group to advise it, and the group advised the minister effectively. So fast forward, April this year, we put in an application to Gavi, which is undergoing screening. And so hopefully by October 2025, we should be starting Ghana's program on HPV.
By raising awareness and improving access to preventive measures and early detection, the MSD, in collaboration with the Ministry of Health and other stakeholders, aim to significantly reduce the impact of cervical cancer in Ghana and Africa in general.